Hello everyone, Dr. Matt Ed. Today we'll talk about hypertrophic cardiomyopathy and its indications for implantable cardioverter defibrillator, also known as ICD. Our learning objective is indications for ICD in patients with hypertrophic cardiomyopathy. First, we'll talk about secondary prevention. ICD is indicated for patients who have survived a cardiac arrest due to VTAC or ventricular fibrillation, as these patients have an increased risk for recurrent events. ICD is indicated if a patient has at least one of these major risk factors. These major risk factors include family history of hypertrophic cardiomyopathy related sudden cardiac death, especially if the family member was less than 40 years of age. That gives the patient an increased risk of sudden cardiac death. Unexplained syncope. The syncope is likely to be an arrhythmia, particularly in young patients. Massive LV hypertrophy. If the echocardiographic evidence of greater than or equal to 30 millimeter wall thickness anywhere in the LV chamber. If there is an LV apical aneurysm present, these LV apical aneurysms have thin wall dyskinetic LV apex with regional scarring, increased risk for VT or VF. If the patient has end-stage hypertrophic cardiomyopathy with an EF of less than 50%, these patients often develop advanced heart failure at a young age, and considering an ICD as a bridge to definitive therapy with a heart transplant. These are risk modifiers that increases risk of sudden cardiac death in patients with hypertrophic cardiomyopathy. With the presence of these modifiers, an ICD should be considered. These include extensive late gadolinium enhancement by contrast-enhanced cardiac MRI, and LGE indicates myocardial fibrosis, and that is significant if there is greater than or equal to 15% of the LV mass. Another modifier include age at time of sudden cardiac death risk assessment. Risk of sudden cardiac death is greatest in young patients less than 30 years old and decreases throughout their life. Therefore, in patients who have achieved age greater than or equal to 60 years old, risk of sudden cardiac death is low, even in the presence of other risk factors. Another risk modifier include non-sustained ventricular tachycardia, and that is defined as greater than or equal to 3 consecutive ventricular beats at greater than 120 beats per minute, lasting less than 30 seconds. There's an increased risk of sudden cardiac death with non-sustained ventricular tachycardia if there are frequent bursts, including greater than one episode, or the episode is of long duration of greater than 7 beats, or if the rate is fast, greater than 200 beats per minute. This is my reference. If you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you for watching.